Did you know metabolic syndrome increases Alzheimer's risk? According to the National Institutes of Health, 1 in 3 American adults have metabolic syndrome. Metabolic syndrome results when a person has a combination of the following: high blood pressure, high fasting blood sugar, excess fat around the midsection, high triglycerides, and low levels of high-density lipoproteins, or HDL, which is known as the good cholesterol. The bad news is that metabolic syndrome significantly increases one's risk of developing diabetes, heart disease, stroke, and Alzheimer's disease. And the good news? Metabolic syndrome is largely preventable or reversible should it develop. Preventing metabolic syndrome is based on maintaining a diet rich in fruits, vegetables, whole grains, nuts, seeds, and lean proteins. Getting 150 minutes of exercise each week. Getting enough deep and dream sleep. Responding to stress in a positive way. Not smoking. And avoiding alcohol. Maintaining healthy body weight is vital. You may notice that these strategies are the same approaches for protecting brain health. Your physician may measure your body mass index, or BMI, at each visit. Though widely used by physicians, BMI is no longer believed to be the best measure for identifying obesity. One reason for this is that BMI does not distinguish between muscle and fat. Muscle is heavier than fat, so someone with a lot of muscle can have a BMI in the obese range even if they are not obese. Two measures believed to be more reliable in identifying excess weight in the midsection and risk for metabolic syndrome are the waist-to-height and waist-to-hip ratios. These are simple measures that anyone can assess with a measuring tape. One's waist measurement should equal half or less than one's height. For example, someone with a waist measurement of 36 inches and a height of 72 inches has a waist-to-height ratio of 0.5. That means the waist measure is 50% of the height. For the waist-to-hip measure, waist circumference should be less than 85% of the hip measurement for women and less than 90% for men. These two measures are better than BMI in identifying excess weight, specifically in the midsection, and consequently, a person's risk for metabolic syndrome and all of the chronic conditions that can follow. Be sure to follow our YouTube channel and check our website for more Did You Know videos.